the inventor of the Vuva magnetic dilators. I'm here with Dr. Mindy today. We're going to be teaching you and sharing some things. And I just wanted to introduce Dr. Mindy. Hi, Dr. Mindy. How are you?
Hi, Tara. I'm so excited to be here. Let me introduce myself to everyone since many of you don't know me, and I'm meeting Tara and her product for the first time, which has been so much fun. But I am a doctor of clinical sexuality. I have a private concierge practice in Miami where I help amazing people live their best sex life. And recently I came across Tara and her dilators, which I'm so happy that we were introduced because I am realizing that so many women out there are having pelvic floor pain. And this is impacting them from whether it's using a tampon all the way up to enjoying sex.
Mhm. Exactly, exactly. And I help women with that on a daily basis. I have vaginal dilators that start very, very small for conditions such as vulvodynia, which is unexplained nerve pain down in the vaginal canal. It can be in the vulva, vulvar vestibulitis, which is in the entrance pain, which they're not sure what causes. It's basically like fibromyalgia of the vagina. They're not sure what causes the nerve pain, but we are starting to figure it out. People with connective tissue disorders, people with histamine problems, mast cell activation disorder, things of that nature. And then also vaginismus, where the muscles are too tight and they cannot have any sort of penetration, whether it's from past sexual trauma, it's involuntary. Dilators can help take that fear of penetration away. Or one of the biggest things most people are going to deal with is postmenopausal painful intercourse due to vaginal atrophy. And so all of these things can take a toll on your mental health. And we're getting doctors to understand to prescribe pelvic floor physical therapy, but there's still a piece missing. And that's where Mindy comes in, a clinical sexologist comes into play that can help you and your partner navigate maybe the pelvic floor dysfunction and think of other ways while it's being treated to fulfill your needs in the bedroom and as a couple.
Right. And you're bringing up these different diagnoses, Tara. And I just want to say I have been helping people live their best sex life for 9 years now. And I will say in this world, there is not a lot of attention on pelvic floor pain. In
Mm-hmm.
general, I think there's not a lot of information on even what vulvodynia is. We just know that it's a pain disorder. And so I think a lot of people, and maybe some of you watching out there, you have this pain, and I think for so long it goes untreated because maybe you just don't even know where to even start. Or you go to the OBGYN and again, like there's different things we can do to help it, but again, there's not a lot of research out there on the treatment, right, Tara?
Mhm. Yeah, so I actually created this for exact the reasons you were just saying. I was going to the doctors and I have vulvodynia. So I didn't just start this company blindly. I started it for myself and it changed my life. So I said I have to help people. The time I started, there was only 2 articles on vulvodynia that I could find on Google. My doctor was telling me to relax and drink wine. Well, that wasn't going to work. And wine has a lot of histamine, so that's actually going to make the pain worse. So I started this company and you know, there's so many parts of vulvodynia that you it's so like debilitating in a relationship and you think that there's something wrong with you and so many people have this and the doctors aren't some I'm not going to say all doctors but a lot of doctors aren't giving you that next piece to the puzzle that is actual pelvic floor therapy and it can be treated and a pelvic floor physical therapist there if you google you'll find them in your area but it's muscular so you can't go to it's a lot of time it's muscular and nerve pain but if it is being caused by tight muscles or your lower back or your hips that your pelvic floor is a basket of muscles if something's being pulled one way it can cause pain a doctor when you have something wrong with your arm muscle they don't treat it they send you to a physical therapist there's no difference you need to treat your pelvic floor basket of muscles by a pelvic floor therapist and you can use dilators at home. They start very small. I have gray and I have pink because pelvic floor dysfunction affects men and women. So I want to put that out there. This is not just a woman's problem, it's men as well. Um, and you know, you can start small if you're scared and you can work your way up. But as far as, you know, getting to the point, you don't have to ask your doctor whether to do pelvic floor therapy. It's your choice. You don't have to get a referral. You can call and make your own appointment. You don't have to go on gabapentin. You don't have to go on amitriptyline, all these nerve pain medications. You need to, that's masking the problem. You need to go to pelvic floor therapy.
Right, and we don't wanna mask the nerves, especially when they're like
Mhm,
the nerves are there for pleasure. But I think there's
mhm,
nothing worse than going to your doctor and being told, "Relax and drink wine," right? Because anyone who tells us to relax, what do? We start getting anxious, like, "Oh my god, I can't
mhm.
relax." And I have so many women coming to my office about, "I can't orgasm," in general. And what we have found is the power of the mind, right? The orgasm
Mhm.
exists in the brain. This is where we actually have sex. This is where we actually experience pleasure. But we put so much pressure on ourselves when we feel that something is wrong with us, that we create this cycle. And I think you are hitting it from a medical perspective. You know, we're going to, I think, when I work with my clients, I always say, let's create your dream team. So, clinical sexologist, your OBGYN, and a pelvic floor
Mhm.
therapist. These can be great dream team people.
Mhm. Mhm.
But there is a huge mental component about, okay, let's treat what's going on medically, but also the power of the mind will exacerbate this challenge that you're going through. It creates shame, it creates embarrassment. So many of my clients say, I am fearful to get into a relationship because now I'm afraid I'll be exposed or somebody, you
All
know,
the time. Mhm. They call me and say that all the time. Mhm.
all the time. And what does that do? That actually can exacerbate the problem because if you have anxiety in your brain, think about when you have anxiety, right? Your muscles tense up. Your pelvic
Mhm.
floor muscles are going to tense up as well. So we're
Gonna
getting
protect
in our
you.
own
It
way.
tries to protect you involuntarily. Yeah. And so probably one of the biggest things that the dilators can do is if you think it's gonna hurt, then you will tense up in the bedroom. And
Mm,
then you will try to put your partner will try to enter, and then you if it hurts, then you feel like you let them down, and then you feel ashamed, and then you feel like you ruin the hour, you ruin the day, or you ruin the date or whatever. But if you take a dilator and you dilate 20 to 30 minutes before or that morning or right before works the best, you are taking that fear of penetration away. You're already doing it on your own, but you're able to relax, and you know that you're not going to let anyone down. So if you take that, you use the dilator, put it in, take it out, and have intercourse, it's what I'm going to be honest. That's what I have to do with my vulvodynia. I have to do it. I'm honest about it. And people go, do you have to do it forever? It's what I have to do. Some people have diabetes and take insulin every day. I have vulvodynia. I have a connective tissue disorder. I use my dilator. So it really helps take that fear of penetration away, and you're not going to let yourself down. So you're going to try, you're going to get to the size you need. And then so when you're ready to have intercourse, you're just replacing this with your partner. You just had it in, so it just goes right in. It works.
mhm.
So
And let's
mhm,
talk about like the beginning of treatment too, when there's a lot of pressure. So some of my clients that come in and they're saying, okay, my goal is to get back to having an orgasm or have an orgasm or not experience anxiety or pain during penetration. And at the
mhm,
beginning, I will say the number one thing we have to do is start removing the pressure to perform.
mhm,
Right. So if you
mhm,
are out there and you are going through this journey and you are wanting to be intimate with someone or have that sexy time, I would say be open with them and take penetration off the table. There are
mhm.
so many ways to be sexy and fun and have an enjoyable time without penetration. So I will tell a lot of my clients to
Yes.
have fun with outer course. Get
Yeah.
creative. Like have a fun sex talk before you have sex and think about different ways to be intimate together. Also,
Yeah.
what do we know, right? So the more anxious we are, the more your muscles are going to tighten. We can expect that reaction. This
Mhm.
is also where the power of the breath comes in. So
Okay.
I think we have to expect that there will be this level of anxiety and know that you're on this journey and that over time it will get better, because anytime we're trying to work through anxiety or change a belief or work through a fear, it is not a black and white thing. So we have to give ourselves
No.
time and like the power of the breath, right? Of okay, we're going to take penetration off the table. We're going to use our breath. Sometimes I'll tell people activate your five senses to bring you back to the moment about what am I seeing? What am I hearing? What am I smelling? And use these deep breaths to just relax for a moment.
Yeah, and take penetration off the table and work on dilators on your own time. And to get you ready for penetration, because there's nothing else that can really get you ready for it besides dilator therapy. There really isn't. Um, and then also, I wanted to ask you, because I hear this in a lot of phone calls, advice for women whose partners are really giving them a hard time. Like really giving, I mean, I've had people's partners leave them. I've had people, want literally be in such a bad mental place that they want to harm themselves because their partner's making them feel so bad and they think that they're making it up. What is your advice for these women to, help them with that?
So let's be real. Sex is probably one of the most vulnerable acts mentally and physically that we can engage in. And I have
Mhm.
so many people call me for anything, right? Whether it's a woman calling, man calling, couple calling, I don't care. Somebody calls and they say, I have my partner has a sexual issue or I have a sexual issue. That's not how I look at it. If you are with a partner, you two are a team, you are a dynamic. One
Mhm.
person is not
Yeah.
struggling alone. The couple is struggling. So if one person has vulvodynia, one person is struggling just from pain, the two of them together are struggling through this. You
Okay.
absolutely, if you are in a partnership, you absolutely need your partner to be there with you. Why? Because if you are working on your self-confidence going through this, you're relearning your body, you're working with your dilators, you're working with your sex therapist, but you have a partner on the other side who then is bringing in that insecurity again or the embarrassment or not feeling supported, you're not going to move forward, right? Because
Yeah.
we react to that person, especially when it comes to sex, because sex, like I said, is one of the most vulnerable acts that we do.
So if any of the ladies that I help, or people that visit the Vuva Tech website, can they book with you through Zoom if they need help, maybe with their partners and things like that?
Absolutely. So I do have a concierge practice in Miami. It is virtual. And my whole goal is to help people live their best sex life, whatever that looks like. I absolutely love my work. And Tara, I'm really happy that you shared your personal experience because you were saying, this is how I learned to live my best sex life. And
Yeah.
that's what
Mhm.
it's all about, right? It's about that pleasure, but we all have to find that journey there in about learning your body. If you come to me, I do have some really fun exercises that are mentally and physically like activating, and they can really help you learn your body, learn your vulva, work through any shame that you're going through. And I offer everybody a 15-minute complimentary consultation just where I can introduce myself, answer any questions, and to make sure that I am the best fit therapist. Also, if you come to me, I will work in conjunction with your pelvic floor therapist if you have one.
Okay, perfect. Once again, this is Dr. Mindy in Miami. She wants you to live your best sex life. And I'm Tara, the inventor of the magnetic Vuva vaginal and rectal dilators for pelvic floor dysfunction. So excited that we could talk today, Mindy. If anybody has any questions, as always, you email or call. I will answer the phone. And hopefully, some of you will talk to Mindy and be able to live your best sex life.
Thank you.
Thank you.